My name is Scott Rollins. I'm the medical director and founder of the Integrative Medicine Center of Western Colorado. Today we're going to talk about supplements, and supplements are a broad topic that a lot of people have an interest in. A lot of people take supplements. In my regular practice, I have patients who are somewhat shy about telling me they do take supplements, as though I'm going to have some issue with it. So there's some misunderstanding about supplements, both between doctors and between the patients out there. And one of the things that I want to help you all do is have a framework for knowing more about supplements. Which ones are the ones to take and how to go about that. Supplements is, where's the science? I want to know, I want to see the data. I don't want to hear it from the clerk at the health food store that this is the latest and greatest product. It may or may not be, and I tend to trust but verify. If you tell me it's going to be good for something, I'm going to believe you, but I'm going to research it. So I want to know where the evidence is. We're going to go through what are we dying from, because a lot of the evidence that determines what supplements you should take is logically things that should prevent what we're dying from. We're going to talk about oxidation and inflammation, safety, what about optimal doses, what about some studies, and then finally a nice little roadmap for you all how to choose a supplement. And again, I'm not going to get into too much specific detail about any one area. The emphasis of this talk is to give you a broader understanding to really help you get started picking a supplement with some good common sense. I think the take-home message for me and for you too is the understanding that they work together, and when you look at nature, they come as a package. And so when we start talking about trying to replicate that through supplements, this is part of the logic in looking at inflammation. Is felt to be the link to most diseases of aging. And CRP elevations, C-reactive protein, are noted with Alzheimer's, diabetes, various cancers, and other diseases. Okay, this is one of my favorite things to talk about, and I go through this a lot with patients. Your body has a couple of different essential fatty acids that it needs. One of them is omega-6. Most people have heard of omega-6, omega-3. This is what we're going to talk about. Omega-6 is linoleic acid. It comes mostly in red meat, shellfish, egg yolks. The important thing to understand about omega-6 is it is broken down oxygenase pathway. So a lot of times when we're using chronic anti-inflammatory supplements for arthritis, for example, instead of putting someone on a solid dose of ibuprofen, we may try a more broad spectrum with natural anti-inflammatories that come without the side effects of gastric ulcers and renal failure. This now comes down to how to pick a good manufacturer. We're going to talk about this. Sometimes you got the wrong version of the nutrient. Instead of Korean ginseng, maybe you've got American ginseng, which doesn't work the same way. So you need to know what version of the nutrient. Instead of the naturally occurring D-alpha form of vitamin E, we get the synthetic. Sometimes more is better. Vitamin E in preventing heart disease, selenium preventing cancers, folate and B vitamins preventing heart disease, vitamin C preventing cataracts, calcium and vitamin D preventing osteoporosis. Again, I'll mention vitamin D specifically. The current RDA, I believe, and maybe the DRI as well, is 400 international units. And we're finding that's not close. That's not even near close. To point out, vitamin A and iron are two that you need to be careful about getting too much of. Vitamin A, more than about 5,000 units a day can be toxic. Beta-carotene is arguably a better form because it'll break down to vitamin A as much as you need. So you can take 10, 15, 20,000 equivalents of beta-carotene and you're okay. Iron, most people don't need to supplement iron.